Good morning and welcome. Thank you so much for joining us today. Today is August 17th, 2024, and we are here in our Commissioners' Conference Room on the second floor of the Administrative Services Building for Larimer County. We are here for a Board of County Commissioners of Larimer County work session, and I welcome you to our session. I am Larimer County Commissioner Jody Shai McNally, Chair of the Board of County Commissioners, and so glad you're joining us today for this work session, which is something near and dear to my heart. And this work session is from the Behavioral Health Services to present our 2026 Impact Grant Fund Award recommendations. And joining me for this meeting is Commissioner Stevens. Also, we have Lorenda Volker at our table, our County Manager, Lorenda Volker. We're joined by Lori Cadrich, which I always have to recognize Lori because she is our Assistant County Manager. She's over here in the corner, and she's keeping an eye on everyone. So I always have to tease you about that, Lori, because where you're situated. And she's off camera. But then I want to just turn this over to our Behavioral Health Services Director, Amy Martonis. And Amy, would you like to go ahead and kick us off and get us started today? And thank you all for being here today. We look forward to these recommendations.
Thank you so much, Commissioner Shattuck McNally. Good morning, other members of the county team, community members that are joining us online. My name is Amy Martonis, and I have the privilege of serving as the Behavioral Health Services Director. We are here today because our community deeply values behavioral health, so much so that in 2018, our community passed a sales tax measure that dedicates 25 cents on $100 spent to behavioral health services and support so that we can expand our continuum of care in Larimer County. Part of the way that those funds are invested back into the community are through our annual Impact Fund grant program, where to date, nearly $18 million has been reinvested back into the community among many nonprofits that provide a range of services across the continuum of care, from prevention to early intervention to crisis supports and public education and outreach. So that's what we're here to talk about today, our annual Impact Fund grant program. And with me is my colleague, Jessica Plummer. She serves as our Deputy Administrator and has managed the Impact Fund grant program for the last several years. I'll turn it over to Jessica, who will share more about our selection process this year and share with you the recommendations for funding.
Okay.
Welcome, Jessica.
Thank you. Again, Jessica Plummer, Deputy Administrator for Behavioral Health Services. We're here today for two things: to share the 2026 Impact Fund grant recommendations. We had brought these to our Behavioral Health Policy Council on August 10th, and they were unanimously recommended by our Behavioral Health Policy Council. And then we're here today for seeking administrative direction for two things: a $200,000 one-time increase for 2026 grant program, and a $200,000 increase to the allocation from $2.8 million to $3 million. As an overview of our funding, we have $3 million approved in our Behavioral Health Services budget for 2026, and it has been budgeted for. We have $2.8 million that is allocated for award by the board. And so we're here today seeking an additional $200,000, which requires further approval for the 2026 Impact Fund, as well as for the allocation moving forward. It's exciting to have another year of grant programs and applications come through. We had 79 grant applications this year and over $6.1 million in requests for funding. Through our vetted process, we have 43 applications recommended for award for $3 million, and that's broken down into two tiers. The first tier one is 39 awards for the $2.8 million, which would allow Behavioral Health Services to award 24 competitive applications and 15 renewals. And then we have an additional tier two for 4 additional awards for an additional $200,000. This would allow the department to invest in 2 new grantee organizations, as well as support ongoing programs with 2 current grantee organizations. As a background and recap for the Impact Fund grant program, Behavioral Health Services has awarded $3 million for the past 2 grant cycles. The last increase to the allocation was in 2022 from $2.5 million to $2.8 million. So if you see from the beginning of when this department started, we started out with $1 million in 2019, In 2020, we did the 2.5 million. We increased the allocation at that time. We increased it again in 2022 to the 2.8 million. And we haven't saw an increase to the allocation since then. In 2023, at the end of 2023, our department was launching the Longview Acute Care Facility. So a lot of our time and effort was devoted to making sure that that facility was up and running and operating. And now that it's been open for 2.5 years, we've been monitoring the grant program, making sure that we were conservative in making any recommendations for any additional funding. We did receive some return funds in 2024 that allowed us to do $3 million at that time. And then in 2025, we came to the board and we budgeted for $3 million and asked for a one-time increase. We didn't ask for an additional allocation at that time. Again, trying to be conservative, making sure that we weren't increasing the allocation as we got the Longview Acute Care Facility operating and underway. So here we are in 2026 with very similar recommendations to last year, requesting an additional $200,000 to round out that portfolio to $3 million, as well as noting the trend of what we're seeing since we hadn't increased the allocation since 2022, looking forward, making that a more permanent fixture for our department moving forward. No problem. As a little snapshot for how those applications have been coming through over the years, we have our application data and trends over time. As you can see, the amount requested has steadily increased over the years. We don't have 2019 and 2020 on here because the first year that the grant program was up and running, it was an invitation-only process for majority of that first $1 million, as well as in 2020 with the crisis response funds. So we have excluded on this chart, but you can see year over year, we have increased from $4.7 million to a high of $7.5 million in 2023 and in 2024, where at that time we were seeing a lot of stimulus funding and a lot of additional requests for funding with ARPA dollars and ARPA dollars going away. And so we saw an increase in not only the total amount of requests, but also the number of applications we were seeing. That didn't necessarily translate into more direct behavioral health related applications. We were seeing actually more wayward applications at that time than we were higher quality applications. In 2025, we came to the board and said, you know, we have all these, we have this $7.5 million in requests for funding. And we realized over the years, with the number of awards what we've been able to give out, we weren't awarding funds more than 100 and occasionally over to up to $150,000. And so when we looked at our data and said, what are the main tiers and areas that we end up funding these organizations at? And they fell into kind of 4 different bucket categories. It was $25, $50, $75, and $100,000. And so we changed the parameters of our grant program from allowing folks to request anywhere from $10,000 to up to $250,000. That was a precedent set in 2019 that we hadn't been able to meet those expectations. And so we reduced that in 2025, which is why you see a reduction to the 5.1 million, almost 5.2 million, is because we reduced the cap of what folks could ask for from that $250,000 to $100,000. The benefit of that was also, if you look down at the bottom of this table, the number of partial awards dropped from 22 down to 5. So it really set the expectations for funding what was being proposed, as opposed to having folks apply for inflated amounts and then, getting part of what they were asking for, and having folks that were applying at organizations as well as our staff have to make a lot of changes during the contracting process. So here we are in 2026. We did see another increase in requests for funding, with even maintaining those funding caps in place. We did receive an additional 9 applications, so that identifies some of it, but we're also seeing a higher median amount requested. So historically, we had folks applying for some of our smaller dollar tiers or dollar amounts, and this year the median was $100,000. A lot of folks were asking for higher dollar amounts than in previous years. So that is the trends and what we're seeing. And feel free to pause me if you have any questions at any time. Yes.
Rebecca, Jessica, I'm reading a name here. Could you because Commissioner Stevens hasn't maybe heard all the information I've heard being chair of the policy council. We did have a couple of folks who applied that for the grants that had no, when you look at this number of how many people applied, some of those that applied really have nothing to do or match the ballot language, so they didn't even qualify right off the bat. And I'm not sure, maybe you shared some of that number total of people applied. A lot of them, I know, or maybe you're going through that next in the rest of the slides, but I just thought it'd be important to note that
Sure.
some of that need is for people who are just applying, maybe just trying to hope something worked somewhere, but I just wanted to kind of clarify that, because that number maybe is not completely showing all the real need, but we know other people are looking for money wherever they can find it, but this is maybe not, a lot of those were not really appropriate to be applying for, so.
Yeah, so in the past, we've come to the board and gone through in detail some of our evaluation process, which is all publicly available online. Part of the first process in the pre-screening process to make sure that organizations are meeting all of the requirements. We did have one drop out at that time and 3 that did not move forward in our pre-screening or initial review from our staff. And for some of the examples that you mentioned, one was wasn't meeting our ballot language. It wasn't behavioral health focused. Some that did not meet our financial reporting requirements. And so there were about 4 that screened out earlier in the process this year. And that is something that we see a little bit each year, but not too much. Those years in 2023 and 2024, where we saw that really high volume of number of applications, are the years that we really saw some things that were not behavioral health related, but we have processes in place to make sure that what's coming through is screened out. And so it maximizes folks' time that are on our subject matter expert panel or our executive review panel.
Thank you very much. I appreciate you clarifying that.
You're
Thank
welcome. I guess the other thing, since we're still on the screen, is the partial awards. We are still striving to reduce that number. We have some folks that were applying for double the amount of what they were awarded previously, and so we couldn't meet a lot of those additional funding requests. There were some that were modified maybe up to the next tier, but couldn't do a 2-tier jump. So we did have one organization that wasn't eligible necessarily for that next funding tier that received a partial, 3 that we kept the same, 2 that we were able to modify, and then as I mentioned, we had a lot of $100,000 requests, and so for 2 of them that were really great programs that we really wanted to see move forward, we scaled those back a little bit, or those were recommended, I would say, by our executive committee and our subject matter experts to maybe take a slower approach in doing a scaled back version of what was being proposed. So that's why we still have some there, and that is why those are highlighted. This is the funding recommendations by targeted project area. And as a reminder for folks that might be listening, our targeted project areas were defined by our 2 advisory groups. We have, in addition to our Behavioral Health Policy Council, we also have our Technical Advisory Committee, those made up of professionals in behavioral health, and our Consumer Advisory Committee, which is made up of those with lived experience navigating the behavioral health system. So these were targeted areas that were put into place back in 2021 that we've continued to fund in these areas and modify over time. We meet each spring with those groups and talk about these. The one thing I will highlight from this year that is noted on here is the workforce expansion and support category. We didn't have any that we awarded in this category for this year. We've noticed it's been historically low in terms of being able to fund things in this category. One of the reasons why is that we know that the workforce issues are vitally important, and they are requiring additional time to build out things like credentialing, things that really help the workforce. Our career pipeline are really multi-year funding initiatives that are beyond the scope of this Impact Fund grant program. And so we have plans, as we've brought to this board before, our strategic plan back in February, and we did a large engagement session last year that really highlighted the need for dedicated workforce supports. And so we brought that, I believe, in December of last year, and then again in February of this year. And then we ended up hiring our behavioral health workforce program manager in April. And so we are moving forward with workforce initiatives as part of a comprehensive community investment multi-tier strategy. So in addition to our Synergy Fund or Impact Fund grant program, there's going to be, or proposed to be, some initiatives moving forward in 2027 to help address workforce that are maybe outside the grant program that would better serve ideas in that category. Yeah, we have a question.
Commissioner Stevens, I see your hand is raised.
Yeah, thank you, Madam Chair. So you did receive at least one request for it, and it was denied because it wasn't, I mean, I know you don't want to speak to, we have to be delicate here, but it was denied because it didn't fit in with the ballot language, or it didn't fit in with that category. What was what was some of the reasoning there?
Yeah, great question. We had probably a handful, 4 or 5, that applied in that category. And for various different reasons, they weren't scored or rated highly by our subject matter experts. And when it came to our executive review panel, they weren't prioritized for award. There was one that came in our responsive category. That's what they applied under. And it was a multi-org, cross-org training for trauma-informed training for I believe, homeless outreach. And so there are programs maybe in other areas, but for whatever reason, those in that category, whether it was increasing staff compensation, things that might not have been sustainable for long term, weren't prioritized by our group of community experts.
Thank you for explaining that, because I know there's the gap here. And so I like that you're thinking about other ways to support this, maybe not through the competitive grant cycle, because there's a lot of need, and there's young people that probably want to go into this field and need that help, that extra lift to get there. So, keep us informed on how you're, kind of addressing that situation, knowing that there are these gaps and there are these critical needs in this service area.
Yeah, Commissioner, thank you for the question. And just to note, I look forward to some one-on-one meetings in the coming weeks to detail more of the workforce strategy with you before coming back to a work session and additional staff effort dedicated to that. I would echo what Jessica said around the applications in this current funding area, and noting that with the timing of our grant cycle, several of the workforce-related requests around wanting to hire a full-time 100% FTE for an annual effort was not prioritized for funding by our SMEs, particularly because of that sustainability factor. But we acknowledge the need and recognize the very real, both fiscal and staffing challenges that our partners are navigating.
Yes. Just to follow up on what you just said, so when people are applying, are they is it understood that we're not necessarily as inclined to support bringing on an FTE, that that's not necessarily sustainable, and that you can't rely on funding year after year? So I'm sure it is, but can you just elaborate just a little bit on that?
Yeah, after each grant cycle, Jessica has been very thoughtful in doing a retrospective where we look at the application trends and the data that's coming in, and we use that to refine our criteria for future additional grant cycles. So you can expect to see some additional language around that, and also potentially a different strategy around workforce coming to the board, that maybe this category is not best fit for the impact fund, and there's a different mechanism to more planfully be able to support workforce for a longer period of time. So I look forward to having those discussions with the board and seeing what gets prioritized for those efforts.
Could you expand, Amy or Jessica, because I have attended these meetings, you do a really good job of engaging when the grant cycle opens to try to walk through and explain to the grantees before they apply, or why they're applying, how it needs to be sustainable, and also kind of how we're also incentivizing the collaborative partnership. And I think it was called the Synergy grant or something like that. And I don't know whether you're going to bring this up. I thought I saw, but I'm trying to remember which one. We're not having one of the Gary Darling Awards because that just wasn't something, there wasn't appropriate award, and that's a very special award. So that's my first comment is, could you please explain for the public and for my Commissioner Stevens that when I think you do a fantastic job with the grantees, almost I would say hand-holding to help them when they're first applying and you're trying to share some of those things, you know, that you don't, even in ROAC, we had explained to a grantee that they wanted us to fund 100% of everything and start both salaries and a down payment for a house and all these things. We're like, we can't, that's not in our bylaws and that's against the MOU. We can't do that. So I know we're going to see more of that. We see it in other places, but could you explain those two things? That would be great. Thank you.
Sure. Some of the supports that we offer to applicants prior to applying are different workshops. We do a 101, kind of an introduction to behavioral health services, our department, what it is that we're funding. We do a specific workshop on budget, how to craft your budget for the next grant cycle. And so in that, we do offer support and trying to showcase that having additional funding to support the work is important in moving forward. We have an objectives workshop where we help folks craft their objectives as well to make sure that they're clear and everybody can understand what they are. And then we have a technical workshop where we actually walk folks through how to complete your application. In addition to that, we have 2 coffee and connection events. One we had in Fort Collins, one we had in Loveland. Both were well attended. About a dozen folks in each one where they could come and ask questions on the grant proposal. Some people came with a printout of their application and said, help me walk through this exactly how it is. Some people had just more broad conceptual questions. Folks got to network with one another. So organizations that are doing work in similar spaces got to exchange business cards and talk and learn about what other organizations are doing or proposing doing or planning to doing. So we offer those supports. In addition, we do make ourselves available for feedback. So even folks before they apply have reached out to ask, can I get feedback on last year's application if they weren't funded, in which case we can follow up. And generally when awards and declines come up in the end of August, beginning of September, we do get a lot of requests for feedback on their application. And we've held conversations and or just email follow-up both with organizations that are looking for feedback. So I think that's been one of the highlights of our program that's different than a lot of other places, is that you submit something to cyberspace and you never hear anything back. And so it's been a huge value add, I think, for folks that are applying through our funds.
And then do you want us to talk about the
Gary A. Darling Award?
I don't know if that was in here or not.
It's not. So thank you for bringing that up. I appreciate that. Each year we have had a like an honorable mention for Gary Darling, who spent his career in law enforcement as well as the Mental Health Substance Use Alliance and getting this ballot initiative passed. And so in the targeted area for alternatives and interventions in criminal justice, we've held one in his honor. We've nominated one. There was, the first year we did it, we had a separate application, and then we said, you know, let's streamline this. We don't need folks to apply separately when they're also applying for our grant program. And so then we were just nominating kind of the best one in that category. This year we have continuation requests for those. We didn't have anything new to highlight necessarily. And so we didn't have any that necessarily rose to the level of rigor that we thought we want to provide a Gary A. Darling Award for. But we do have some in that category that are continuing to do great work, that have been doing great work. And so we want to continue funding those, but didn't feel like there was one specifically we wanted to honor this year. So that was a little bit of a deviation than what we've had in the past.
Thank you.
Mm-hmm. So the next slide just shows the breakdown of how we're funding things across the portfolio. So one of the difficult jobs that the executive panel has to do once subject matter experts review all the grant applications is that there's generally more recommended for funding than we have funding to give, and they get the difficult task of trying to narrow that down and to make sure that we are funding things across the portfolio in these different targeted areas. And our advisory committees had told us we want at least 70% of these funds going to these targeted areas, and so we make sure that we are meeting that requirement. And so this year we had 78% go to those targeted areas, which is still more than 70%. In previous years we've had 80, close to 90 in some different areas. But like I said, we have, there was a lack of workforce applications this year, but also they're embedded workforce components are embedded with training and development in a lot of those applications, as well as, we know one specifically is in responsive. We just didn't happen to move it into that category, but that's where they applied. So we do have met the target area for at least 70% going to that. We also share with our Behavioral Health Policy Council where these award recommendations across the portfolio are reaching folks in the county, and this is what comes out of their applications. And we have a staff member put this together for us to show the outreach from these organizations to all these different areas. And we had a conversation with folks from our Behavioral Health Policy Council who are elected officials across all the different municipalities, wanting to make sure that regardless of whether folks are accessing services in Fort Collins or Loveland, no matter where their address is, that organizations are making a concerted effort to make outreach to those different municipalities. And so we can see that here, and how that's kind of trended over time is that a lot of folks with telehealth and different technologies, virtual care, can reach all of Larimer County, which is why you see a high proportion of say, hey, we serve everybody because we're accessible in all these different formats. And then we do have organizations that are providing in-person services in different municipalities. Fort Collins and Loveland always tend to be the highest, where we have kind of the most resources, the most populations, but we see that there are specific outreach to some of these smaller areas within Larimer County. So across the portfolio, if all 43 awards are recommended to move forward, how that breaks down is into bringing on 8 new programs, new grantees this year. New grantees being defined as the first time an organization or a sub-organization has been awarded. We have 1 new program, which means an organization that has been awarded previously, but the program or scope has changed. We have 19 continuations, so organizations that have been awarded previously, and the request is continue that work for another year. And that could be consecutive or not consecutive. They might have applied 2 years ago, might be reapplying, and might not have been funded last year. And then we have 15 renewals, organizations that had 5 or more years of funding, they met additional criteria and had a streamlined application process. I will say that the proportion of this is similar to how we've seen things in the past. We always bring on new grantees every year, which means some need to kind of fall off in order to make room for new programs. The split between new programs and continuations is a little bit different. I think with the different funding climate that's around, we're seeing less new programs being proposed and folks just kind of sustaining the programs that they currently have. So we do see a little bit a higher number in that continuation space and fewer in the new programs, and we suspect that might be part of the rationale for that. Do we have a question? Okay. So our communications plan moving forward is to do a press release. We have all these things drafted. Our communications coordinator is out on leave, so I will do my best to make sure all these things are coordinated in her absence. But we have our Lamplighter newsletter drafted, which has our 2026 potential recipient list, as well as our grantee communications toolkit. She did a fabulous job creating this toolkit for organizations so that they had social media templates. And so part of their award notice goes out with this communications toolkit of like, here's how you can help showcase this on your social media channels. And so we also have a spotlight working with public affairs to get that posted on the BHS website, our county site, and the B board. So if any of those things are delayed for any reason, that's on me while she's out. But they've all been drafted.
And just to say, she is welcomed a new member to her family, beautiful new member to her family, and we wish her all the best, her and her family.
Thank you. So these are the beautiful templates that she's designed. I think they look stellar. I'm so excited about them. Very calming and look lovely. So you can look forward to seeing those in some of the communications channels. Something new that's really exciting is our new searchable grantee database. Every year on our website, we've always posted who's been awarded, so you can look those up. They're listed by year, and they're kind of a static PDF document or list. And so what we have, this is not live yet, but it will be live once awards are approved for this year. but you'll be able to go onto our website, be able to search by year, by organization name, by the funding area, and be able to search our database to see who's been funded and get all those details, as well as the grant amount totals by year. So you can see, like we've shared with you in this PowerPoint and in different modalities, the number of grants per year and the total award amount. So that level of transparency will be available on our web pages shortly. So that's really exciting. And here we are at the end of our presentation to get some administrative direction on the 43 grant award recommendations for $3 million, including the one-time $200,000 increase for Tier 2. And I'll pause there and see if we have any questions or discussion.
I have a question before we make any administrative direction, because I do have some concerns about the last request. But Commissioner Stevens, I see your hand is raised.
Thank you, Madam Chair. So yeah, I don't necessarily have a problem with a $200,000 increase, and it seems like it's kind of the trend, but maybe you can speak a little bit about, you know, I know we've sort of waited to make that ultimate decision, seeing how things would go at the Longview Center. With some of the changes to Medicaid because of HR 1, are we feeling like we're still in a good place to you know, adjust the amount that we're, you know, I guess officially adjust the amount that we'd be giving out in future years? Maybe you can just, I think people might be interested in that because we know that some of those changes haven't quite happened yet, and we know they're on the horizon. And so just for sort of a fiscal check-in, can you speak to that?
Yeah, absolutely. Thank you for the question, Commissioner. We really value how closely we work with our contracted provider for clinical services at the Longview Acute Care Facility, which is Summit Stone Health Partners. And prior to looking at recommendations for this next fiscal year and the grant program going forward, we've continued our monthly financial joint team review meetings that the Assistant County Manager also joins for on a monthly basis. And we look at the contracting for the year ahead with our local RAY and the service codes that are utilized to provide care at Longview. And based on a complex fiscal picture, which I can dive into as helpful, our care codes that impact the Longview financial picture are not being restricted in the way that Medicaid changes are impacting other parts of the state. And so we are forecasting to hold steady at the same financial picture that we did for the past year. As we look forward, other factors that are impacting the total picture is that this will be the first year the Longview facility has all 56 beds open. So by the end of September, we're anticipated to be at full capacity. And so with that recognition, in some ways for operations, we've held more expenses through a ramp-up phase. And now we will have more capacity to offer care, which at the end of the day also impacts billing and the fiscal picture. And so in naming that and naming reaching capacity, I recognize there's two elements to that conversation. One is the very human side of the ongoing need in our community, where approximately 800 visits to urgent care are happening every month. And we have seen a steady rise from about 200 at opening through 400. And we keep wondering where the threshold is, but about 800 folks per month seeking care in urgent care. And recognizing that an expansion of beds is both utilizing the facility to its maximum capacity, and that represents our community members who are in need of significant behavioral health care. But when we look through the complex intersection of what all contributes to the fiscal model at Longview, we're projecting things to stay level as we look forward. And as the Medicaid changes roll out, rule changes continue to unfold for this next year, we look steady.
Yeah, we have Lori Cadrich add, and then I have a follow-up too. I'd like to build onto this. Assistant County Manager Lori Cadrich, I see you'd like to say something.
Yes, I'd just like to add to Amy's assessment of what we looked at before we made this recommendation to the board, because I'm sure she would remember it's the first question I asked her when I saw this recommendation. Two other factors I think that are important. Each month that we look at our Longview contract, we do end up with a revenue share position. that dollar amount has been anywhere from $400,000 to $600,000. And so we do feel like there's a cushion, even if there's changes in some of the codes that help us or hurt us. We have a cushion in what have existing. In addition to that, we do have a fund balance in the overall account, and that fund balance is nearly $30 million. And so we do feel comfortable making this recommendation of $200,000 and having it to be sustainable for at least the next 3 to 5 years. It may need to be adjusted as the board decides how much money you want to allocate to the community goals. But then we could have a more comprehensive conversation about the overall picture if that's what you desire to do.
And I'll add that the $30 million reserve is intended to be an additional service. So it could be that we contract with another organization, that we perhaps build another facility on site. So that is not just sitting there waiting to be spent. It's waiting for the right plan at the right time. And Amy and Jessica have done a great job of kind of forecasting where we're going to be and what we think we'll need to do as a community.
Yeah, because that master plan showed that we were going to expand and have another building and have maybe some more day facilities for people seeking care. And so I just want to make sure everyone knows there was this master plan, the very beginning when I was running around trying to get this passed, that we were looking at expanding and having other services there, another building, and that the current building is $45 million way back when, and that was 4 years ago. I'm sure it's way more expensive to do the same building now. Commissioner Stevens, I had something to build on, but I know you had another question you wanted to ask on that.
Thank you, Madam Chair. Yeah, so in addition to sort of the care codes not changing, I mean, we are likely to see more people show up to the doors without Medicaid as an insurance, and then maybe no other insurance at all. So do we feel like that's, clearly, I'm preaching to the choir. You understand that this fiscal cliff is coming, and reserves, can get eaten up fairly fast if we're trying to. So what do you feel like that looks like in the coming years?
Yeah, as we visited with our partners, the interesting thing about how the federal climate is changing as well as the state climate, the unique services that are provided at Longview enable us to get additional revenues from some code changes. And we are building out revenue portfolios that we didn't have before, like with prescription medications that are now being issued. And so when Amy and I looked at everything, we still felt comfortable with the $200,000 as being sustainable. Again, if that's what the board wants to do, we can come back each year if the committee asks for additional and ask the board if you're willing to approve it. So however you wish to move forward, it is fine with us.
Do you mind if I ask a question, Commissioner? So I'm concerned because we talked about, because this was how it was presented to the policy council still seemed like you were thinking the policy council was making this recommendation. I'm glad we fixed that. But it kind of came for me, I'm a little uncomfortable because I'm not comfortable with the HR cliff. I don't think we know. And we have gone up from 700 to 800 a month. And now we're at full capacity. And I do think that there will be more people showing up at the door that will not be able to pay. Especially when there's going to be SNAP benefits and people are in crisis. And I'm not sure what that looks like. You're taking the workforce out of the grant cycle potentially and having that funding. So that still leaves room for those other needs. And we also have a project that you have been working on with the application to provide a systematic change so everyone anywhere can have access to it. And I know that costs money. And so I feel like we have some unknowns right now between this workforce, and Ruth Krug is doing an amazing job from what I hear. She's our workforce development manager. And I'd like to see what that looks like, because that sounds to me, what you present in the policy council is a very large amount of money, which is more than what you're asking for here. And so I would like to, I'm not comfortable today, but I'd like to see how this works out. I'd like to see how the HR ones, if we're going to see more of an increase, every year we have looked at it and looked at the recommendations, and we have been okay with that. But I think what I'm worried about is we move up to 3 million now. Next year, you're going to come back and say, how about 3.5? And then I feel like this was never intended to be the big, we wanted to, I remember the conversations and what we had talked about was kind of holding this for a while as we got the facility go up and going. And I know it's going very well, and you talk about this balance, but I still am uncomfortable with the HR1 cliff. And a lot of people who might not be able to find care otherwise, it might show up at the door. And I don't know what that's going to look like. And then we might need more room. I've heard whispers that staff says, oh, you guys are going to add another wing. I didn't know that. So I don't know where that came from. But those kinds of things are just, yeah, someone said that to me the other day and I was like, what? So I don't know where that came from. But I just would like to see how this all settles and maybe just hold and then go ahead and improve it for this year. And let's see how this all shakes out. And then next year, when we have a little more data about the workforce, since you're probably not making that part of the year cycle, that leaves that gap for other grantees, right? And in the past, that was more than 200,000. And then we have the HR1, and we can figure out how the app is working. And then we kind of maybe have a clearer picture of the sustainability of all of this. I'm really nervous about all these. I have all the confidence, and I know I think you all have that cushion. But, and also, we just got a thing from the coroner talking about some of this, some of these deaths and some of this overdose with the trend with the Crampton or whatever that, let's see what these products. And so I don't know what that looks like. And I just feel like we have, my gut says maybe we should just wait another year, hold in this, prove the 200 or the tier 2 that you have, and then let's see how the rest of this works out. Because I feel like there's a lot happening, which is all good. This is great, but I hate to have to cut it back. I like to make sure it's going to be sustainable for maybe even beyond the 5 years. So I'm just curious about that. Mr. Stevens.
Yeah, so if you've done the math and you've done the sort of fiscal analysis and you feel like we're good to move ahead, I would be okay with increasing to 3 million. I don't really believe in the value of this and, having those dispersed dollars into the community, because I do, the facility is great and people access mental health in different ways in different spaces depending on where they live and their needs. So, yeah, it would be good to have input from Commissioner Kafalis as well. But I do understand, that we have a lot of balls in the air at this point, but trust that we can, have these dollars go out. Did the ballot speak anything to how many dollars went out in the community versus? No, it didn't. Okay, so. Yeah, I do like this because I think it helps us reach some of more our rural areas and smaller communities, and that I think there's a real value in that.
So commissioners, there were 2 questions. One is for this year, the 4 additional tier 2 projects, and then the second question was the ongoing increase to 3 million. So I think what I'm hearing, just to be clear, is you 2 are okay with the funding the 4 tier 2 projects for this year. Holding off, though, perhaps on the 3 million escalation for the program until we get more consensus with the 3 of you present.
And I think also, I don't think there's a harm in waiting a year. It's not that we're saying you could come back next year and still say the 3 million. It's not going to keep it out of the community if you find something worthy. But pulling that workforce out and putting another potentially, 6 to 7 digit things out in the community, I think that's important, that's increasing the work. And so I think that would be important to make sure that's all sustainable and how that all works before we kind of move forward with making that permanent move up. I just like to see things, but you have like 4 or 5 different things that are going to start taking funding, and I just like to see how that all works out. So that's where I'm at. And it's not that, of course I know this is doing great work, and I just toured a facility on Friday, and it's on this list, and got to see the work that's happening, and they're trying to expand, and they're actually expanding to other cities around the state because the need is so great. So, but they can't find a place they can afford to move into. So, I just feel like I want to be cautious because I think we're going to need the sustainability the next few years. And 800, that's amazing. I'm glad we're really at full capacity, but it makes me also wonder, what is that? We're going to have a lot more people, I think, showing up that can't pay. So that's just my gut reaction. So, but great job on the presentation and all the information. I really appreciate that.
It always impresses me, the amount of work that goes into this 45 minutes of you presenting to us. These are hours and hours of subject matter experts who are volunteers who help review these applications and then give them to you all who have to make the ultimate hardest decision. So thank you to everyone who participates. This is a real community team effort. It's really impressive how it's gotten better and better every year.
Yes, and please thank all the subject matter experts in your executive panel because they are spending dozens of hours reviewing all of these. And I know you've something that you shared with the policy council is you have cut 22 hours out of the reviews for the subject matter experts. And I'm glad that we're trying to reduce their amount of time, respect their time, and make this a process that honors because they're not getting paid, they're volunteers, but they're very, very important in the process. And I'm glad that we're doing a lot to adjust and take care of them as well. So, Jessica, well done on that.
Thank you.
Just wanted to express my appreciation to the board for your thoughtful consideration of both the recommendation for this year and for the additional conversations we can have to align on strategy in a forward-facing way, and appreciate the pieces that remain unknown for the year ahead, and trust that we will navigate those thoughtfully, conservatively, and look forward to what's ahead as well. So thank you for your direction and for the conversation this morning.
Just for the public's, are we at least going to move forward? So, because we need to move forward, that will be on the consent agenda for approving this current year's grantees. And will that be tomorrow or next week?
Next week.
Next week
Yeah.
on a consent agenda.
Consent. We can put it on consent agenda.
Okay, great.
Thank you.
All right. Any other questions? Lorinda, did you want to wrap up with anything, or Lori, any comments, final comments?
I just want to say that when I thanked all the volunteers, I need to thank the staff. The work that you all do up front to make it really easy for people to understand this process is remarkable, and I think it speaks to why the rest of it goes so smoothly. You've anticipated what they would like to know. You've made a space for them to ask questions. No question is a dumb question. Everyone is welcome, and I think that has made a difference in the kind of applications we're getting and the meaningful work that's being funded in the community. Thank you.
Yeah, I think that's important. I'll add on to that. That's why I asked you to explain that, because I don't see that happening with any other grant process that I have been involved with. And usually you're just constantly asking or trying to figure out, how do I do this? But I also want to highlight that you all brought all the providers in and behavioral health providers and had, how do we avoid burnout? How do you take care of yourselves in this environment? So you're also doing activities to support our behavioral health community and providers to help them have a place to come and collaborate, partner, support each other, ask questions, get ideas, and I think that is also extremely remarkable. And so the work you're doing to support the community and the work that they do, as well as getting this money out, is I don't see this anywhere else in the state, in the region, and I just wanted to make note of that the work that you're doing is extremely impactful, impact grants, and remarkable, as I said, but tremendous, and I think it is really going to help keep our landscape and environment sustainable and ongoing. So just wanted to really make a note of that. I found that attending that morning was really even helpful for me, being in my position and thinking about how it's really important to take care of ourselves so we can take care of others. So, all right. So without any other comments, at 11:49, we don't have any further business. Thank you for joining us, and have a wonderful rest of your week. And we are adjourned at 11:49. Thank you.